Seun Onigbinde is the CEO of Budge IT, also known as Budget, and Dr. Ola Brown is the founder of Flying Doctors Nigeria. Thank you. So let me just quickly ask, when it hit Nigeria, what were some of your earliest or first concerns? If you say, what is something that you remember flashing through your mind as COVID hit Nigeria?
I mean, it's about the state of our healthcare. Anyone that follows Tracker NG would see how, and we had some pictures yesterday from Castina, a primary healthcare center in Castina. You know, tattered mattresses, drip stand on sticks. You know, that's what we have seen so far. I mean, every Nigerian governor tries to build roads, try to build bridges, try to build centers, try to change roundabouts. I mean, no one thinks healthcare, education, or the social infrastructure of a state is as critical as those physical infrastructure, because people feel like when I build the road, when I build the bridge, there's a visibility in some sort of way that I'm working, you know, and constantly we have underfunded healthcare, even at the federal level, at the state level. And so my first concern was, you know, how many cases can we manage? No, how many cases can we manage as these things continue to escalate? Even you look at developed countries like the United States, they have come to a break point in places, especially like New York, I mean, or even at the point in Seattle, or what you have in Italy, or what you have in Spain, or what you have in France. We have ICU beds, less than 400 ICU beds in the entire country. You know, we don't produce in great quantity. We don't produce health equipment. Neither do we produce health infrastructure stuff. So I worried a lot about preparedness, and this is something that your team and ours has been working together with the Resolve to Save Lives project about. You know, right. I wouldn't even think about this was ever going to happen almost a year ago, about how the preparedness of Nigerian states, you know, for epidemics. I mean, it's really shallow. For example, I will show just some states, an average state in Nigeria spends less than 10% of its budget on health. You know, there are states that spend less than 4% of their budget for health. The federal government itself does not spend more than 5% of its budget for health. And so when you look at states, countries like the UK, even countries like Germany or United States, or even South Africa, you find out that the average spend on healthcare in the budget is between 15 to 25%. It can even be as high as 30% when you look at countries like the UK that do have this robust public healthcare system, such as the NHS. You know, we don't even have a robust public healthcare system. We don't have a robust health insurance system, and health infrastructure is grossly weak. So I was a bit alarmed that how much of this can we go? And, you know, we might pat ourselves in the back about our efforts so far, but we also have to be, you know, thankful that, number one, we've not gotten, I feel that there are violent strains of this COVID-19. So I don't think we have gotten the very violent strain. Maybe I'm wrong. And number two, I also believe that the cases have not multiplied beyond measure. So Lagos streets over 1,000 cases now. I mean, that's still manageable. But you just imagine, imagine 1,000 cases in like some states like Bauchi, in Gombe, even in as close as even in Oyo or even in Ondo. It can be very, very problematic. So for me, I worried, and my biggest worry was we have underfunded health over the years, and this was corroborated by the Secretary to Government of Federation, that he did not know that the entire healthcare system in Nigeria was this bad. Man, seriously, it is that bad. Yeah, technically, yeah.
Ola, let me come to you, because I know that Flying Doctors has partnered with states to deliver and to respond to the outbreak. So what kind of advice would you have for states who are looking, when it comes to partnerships to respond to COVID, based on the work that Flying Doctors has done?
So, you know, it's really, really hard to talk about Nigeria in the global context, because, you know, our poverty just makes everything so much more difficult. It's such an inconvenience to be a poor country, because you just can't do and undo like the rich countries. You really have to be a bit more innovative around spending for healthcare. So my brother Seun was talking about the UK. I'm saying, oh, you know, that they use this percentage of their budget. You know, when I looked at the UK's budget, it's actually over $200 billion that they use on healthcare for just 60 million people for a year. So of course, people are going to be okay because they're using Nigeria's entire budget for 10 years to do healthcare for 1 year for like a quarter of the number of people. So really, poverty makes everything inconvenient. And because our states are so poor, some of them borderline insolvent, you have to start thinking about, okay, how can the states do more with less? And you can see countries all over the world that have been able to do more with less, which proves that it's not completely a money game. Vietnam is not that much richer than us, but they've actually handled COVID extremely well, considering their resources. Countries like South Korea are poorer than America, but you can see Taiwan is poorer than America, but you can see that they've had a better response in some respects, by some opinions, than even the richest countries in the world, so countries like the USA. So some of the projects that we've done in states, for example, are our molecular lab project, where a state decided that they needed a molecular lab for testing, but instead of buying and running it, they decided to lease it on a monthly basis, and that gives them flexibility. So what we did was set up testing centers, and we now run one of the busiest testing centers in Ogun State, actually, where the people come. All the suspects come to a certain testing center, and they get their tests done there. We also designed and created a testing booth. So we're able to make testing safer, faster, and cheaper for the first time in Nigeria using that methodology. So that was another way that we partnered with the states to try and increase efficiency. And these are some private sector solutions that, designers, thinkers, makers in the private sector can bring to state governments, because the governments are really, really busy. Who has time to be sitting down with professors to design booths and equipment? They're already busy doing so many functions, plus they're still running the original primary healthcare system and the emergency. People haven't stopped having emergencies. People haven't stopped giving birth. This is just another burden on top of an already overburdened civil service. So I think that the private sector can, because we are slightly away from the action, we can actually look at the processes and think, okay, how can we make this process more efficient? We also have funding that we can bring to bear to make the way that they spend more efficient as well. Like I told you, instead of buying a whole molecular lab and procuring it from China and bringing it in, we could deploy that in a few days, and we could give it to them in better financial terms. So these are some of the things, some of the ways that we have worked together with governments. We've run these testing centers in several states now. These are some of the ways that we've made testing more efficient. We've done some advocacy work with states, and this is, I think, what the value that the private sector can bring to governments are really, really burdened. And like I said at the beginning, poverty also makes everything more difficult. So they don't have money either. They have to use their resources really, really wisely. They have to cut costs wherever they can. And these are some of the ways that we've been able to help with that.
Seun, I'm going to come back to you. So Ola has just told us that states don't have money to take care of issues. But then I want to ask the accountability question. Accountability is a huge part of the conversation, especially when you're talking about funding. So there's been, money released for different things when it comes to the response. The federal government has released some funding. States are, working on releasing funding. How can federal government, states, how can they be held accountable for the funding that is being allocated to the COVID-19 response?
But my worry is, I know that we're a poor country. I mean, relatively in everything we are poor. I mean, our entire budget now, even with the devaluation, even makes it more worse. I mean, we don't have a budget that is spending more than, as a federal government, more than $20 billion in a year. I mean, if you adjust that also for the states and local government, it's not up to it's around $35 billion in a year. I mean, even and then we adjust what the New York Police Department and you had upon what is fire service and some of its essential services spend alone. That's even more than, you're not even looking at the city's budget, you're not looking at the state, but that's even more than what's that's equivalent to some departments in New York. So we're really a poor country, and that's something that has to be done. And we are poor because we have not been a productive country, and as simple as it. And health is critical to productivity. I mean, no matter how much we try to look at it, the country that an unhealthy country, a nation, or a poorly educated country cannot be productive. And so those countries, when you see people use the budget instruments to advance specifically education, health, social welfare, and defense, is deliberate, just because they know we can only be productive in an educated, in a secure, and in a much more healthy environment. So I would put that as a framework first. Secondly, we're a wasteful country. Even though we're a poor country, we're also a very wasteful country. So, and that's where you now bring issues of accountability into it. For example, we did some maths to see that some states, and we report is coming so at the end of the month. So the chief of staff office for some state government, they have a bigger budget than the health sector. And that's how bad it is, because our priorities are just not right. And I think that's when the accountability comes in, that even in the little that you have been wasteful with it. How much does it take to stock up a primary healthcare center? I mean, maximum you take maybe by the time you put 50 million naira into it, you would be decent. With beds, drip stands, just make it look decent. You are not saying a primary healthcare center, it's not going to resolve complex issues. It's just supposed to be a first stop place in case there's a crisis or there's an issue. Or even to put a 50 million naira investment in each local government or in each ward, around maybe 30 local government or 25, it's a difficult thing to do in Nigeria and constantly maintaining. And I think that has to do with how much money we have or we don't have. Because we have 1% we have the National Health Act now. We refuse to implement that as we should have diligently done it. We have the NPHCDA, the Primary Healthcare Development Board. We never did as much as we could do with that. I mean, we have the state government having the instrument, but everybody tries to do the wrong thing or to do wasteful thing rather than invest in it. And I think that's where we as citizens have to put our foot forward. I mean, how do we hold government accountable? And it's by asking questions, rigorous questions, constant questions. Put the pictures in their faces, put the videos in their faces, and being persistent enough with it. Because based on what I found out that now, without us not investing in healthcare, everything can easily shut down. So this presents a very incredible work for it. And I'm going to run with some data so that we can know what we are talking about. So we have I will take 5 states, for example. I mean, we have the data for most of the state. Kebbi State Kano has a budget of 297 billion, has budgeted 12.7 billion for health. That's 5.8%. You have a state like Ogun State, has a budget of 400 billion, budgeted 22.5 billion to health. And don't let us forget that the budget is like the ceiling. So even if you, except in emergency situations like this, when you can say, okay, I want to spend beyond the budget. Ondo 15.2, that's 15.1 billion in a budget of 193 billion. Same thing with Oyo, the same thing you see in Taraba, the same thing you see in Yobe. It only seems like Kwara that you see that their health budget is relatively high, around 17.8%, or Bauchi, just because also a whole lot of funding for some of those states are also supplemented by donor funding and also by international partners. So in some sort of way, there has to be a deliberate way for us to put health in the front burner. And it's about understanding that public resources are finite. They are not running forever. I mean, so you need to be able to define that with competing interest in public resources. What exactly do we prioritize? What exactly do we bring forward? And it's not just about how much money we've had not to put a primary healthcare center, or maybe when we didn't have enough. In the 60s, people had children in UCH. I mean, people flew out of the country to have children in UCH. I've met people out of the country to say, oh, I was born in mainland hospital, Yaba. I met someone in maybe London, said she was proud about it. My parents was a diplomat in Nigeria. I mean, and we were just a country of 45 or 50 to 60 million people there. We didn't have enough resources as we had right now. But somehow we still got these things working. So for me, but now we've destroyed the private space and made it so hollow that the things that you ideally should find government not doing, they start doing them. So things that should be PPP projects, you see government putting all the resources in there. The primary role of government should not be, are 4 things. In my own view: healthcare, education, social welfare, and security. Anything beyond those 4 things is extraneous. And it's something that you have to clearly justify that there is no viability mechanism for it before you dabble into it. But we have turned it the other way around just because we want to be seen. So it's back to us, civil society, government, citizens. How do we mobilize our social capital to hold government to account? See, there's a political will, there's a resolve, and there's a sustained action from the citizens or the civil society. we're not going to get all of this. I mean,
so the federal government recently has come out to say that it's proposing, to review the budget. And I wanted to get your thoughts, the both of you, on how do you think the proposed review of this budget will affect the healthcare budget? There's also been some rumors around that, but when you think about the government proposing to review the budget, how do you think that is going to affect the healthcare budget? Ola, I'll come to you.
So I think the discussion is generally in Nigeria, when we talk about healthcare, it's about the government and what the government needs to do and what the leadership needs to do. And that's a really, really important part of the conversation. But 2 years ago, I wrote a book called Fixing Healthcare in Nigeria, and it was sort of the policies that I thought, a collection of the policies that I would suggest that would fix the healthcare system in Nigeria. And I thought, people would be really enthusiastic about it because it was coming out before an election and the healthcare system is really bad. But, nobody was really that interested in it. And I realized from living in England, from living in Japan, from working with a lot of Americans, that politicians actually do things when people are interested in it. They do things that people are interested in. So in a country where people's primary interest is getting money in election day or getting rice, that's what they're going to do. The reason why the NHS has become such an institution in Nigeria, in England, and everybody needs to add money to the NHS when they win an election, it's because it's an election winner, right? If you cut NHS money in England, you can't win the next election. So every politician has to talk about the NHS during their campaign, otherwise they will not win. And if you notice, in the American campaign season, all they talk about is healthcare. Is it Obamacare? Is it Trump care? Is it another kind of care? What kind of care is it going to be? It's the entire election is focused on healthcare. And because citizens are really, really passionate about healthcare, and citizens will come out on the streets if healthcare is not mentioned during the election, then the politicians really feel under pressure to provide healthcare. And I think so it's really important for civil society in Nigeria to lend their voice to healthcare. And I also think it's really important for more doctors to advocate for healthcare. So I wrote an article recently about the coronavirus fight in Nigeria so far. And, we've heard a lot of politicians speak out about coronavirus. We've heard, the bankers, we've heard accountants, we've heard economists, we've heard even geography students, but we really haven't heard very much from the doctors. And if I look at the UK, if I look at Germany, if I look at the United States, then the scientists, the doctors, the academics actually take front stage center of everything that is going on. Even when Donald Trump comes out to give his speeches, he's always surrounded by doctors and scientists and experts. Whereas I feel like in Nigeria, that hasn't been the case. And I think that, in our medical community, I know that there's a lot of doctors, a lot of lab scientists, a lot of nurses watching this video as well. I think that we also have like a huge role to play in terms of advocacy, in terms of speaking out, in terms of saying the right things, because if we're not speaking, then there's a huge risk of information. There are people that will fill in that vacuum. So I think we've spoken a lot about the role of government, and that cannot be underestimated. We need to have the political will to make these changes. But I think also we need to also educate the public. We need to speak out more about this issue of healthcare, and we need to make sure that our voices aren't drowned out by people that know far less than us about the issues.
Seun, I will ask you to just quickly reflect, on how you think the proposed budget review will affect or could affect the health budget. And then we have questions. So we will try and run through as many questions as we can. So if you could just quickly reflect, and then I'll move over to the Q&A.
All I've been saying is economic sustainability plan, economic sustainability committee, valid. I've not seen a time, I've not seen another committee or another conversation, another policy thinking around quality or the state of our healthcare. I mean, whatever we're doing right now is ad hoc, and it's not sustainable and it's not inadequate. I mean, I know a lot of people are doing so much. Landmark Center, people like what Dr. Lano has been involved in that. I mean, trying to do a mobile testing center and things like that. we have still not figured out, I mean, that the root of all of it all is just because we don't still have a proper structured plan for healthcare system. And if we think this is just about the economy, this is not just about the economy. The COVID-19 situation that we have right now, it's not going to go away until possibly March next year. I mean, it's better we just have that kind of understanding. There might be adjustments right and there, but a vaccine is not planned till October, even in terms of trial results. Before a vaccine could go around up to 5 to 6 billion people, could be another 6 months. So, I mean, we can look at the economy, but we also have to look at if our cases escalate in terms of scenario planning, how do you manage all that going forward? And so I've not seen situations to say, this is how we're going to, in a long term, have a conversation about healthcare. I know there's a National Council for Health, and there's always this meeting and this night, and I think maybe it's just a place to drink gallons of coffee and share ideas. Maybe I'm wrong, but it has to be a holistic national plan for healthcare in terms of strategy. And this might say, oh, the federal government handles tertiary and state handle primary and secondary. The federalism, the structure that we operate as an economy does not make state productive. Does not even give states the opportunity to explore. I mean, you are a state, you can't even control your payee taxes. The payee taxes in the country is centralized. You are in a state, you can't even control right of way to some of extent. I mean, in a way, there has to be a clear understanding about as a nation, because it's a contagion. Whatever happens we thought this whole thing was going to be in Lagos. Somehow Kano is over FCT right now, and I think the cardinal numbers are still not representative as they should be. And somehow you can see the axis of the Zamfara, the Bauchis, the Gombis, and the Bornos are constantly rising, in 20s and 10s on a weekly basis. So it's important that we understand that this is not just about a state government getting itself right. This is about there should be a national strategy for healthcare. And I think that's what we are still missing right now. We're still missing issues around citizen data identification. One of the things that you see countries, which Dr. Ola made mention of, is healthcare is a critical element of the social contract. So you don't just, Nigeria, there's no social contract in Nigeria. You don't just exist in a state or in a country and I say I just exist. I exist because I have obligations to the government, and I exist because the government even has obligations to me. So whatever we call the NHS, or what you call Medicare or Medicaid in the US, or whatever you call as benefits in other countries, are tied because you are a citizen in the country, responsible, meant to pay taxes, and the government is supposed to be responsible back to you in some sort of way. And so we can't even fix that without even knowing who we are. Which citizens do we have? What is their economic status? I mean, where do they live? What are their biggest pain points? I mean, until we're able to even define those questions, and we now put a layer of social contract there, that's when we know that as a citizen that paid taxes in Lagos State, I should be able to have quality healthcare services in Lagos State because I have a tax card and that guarantees me some level of quality healthcare. That's the way it should be. And until we're able to fix things like that, we are not going forward with transforming. And that's when people begin to see these are major issues about, I can get access to quality healthcare because I pay taxes. And then people begin to say, we want to pay taxes, even no matter how much small, how little it can be. And that's the way we transform the system. And that's when we now layer even things around healthcare insurance on top of that. But in the way we are addressing it now, with most of the funding still going out of pocket, and most people still, even the healthcare insurance that we even have as employee, still need a whole lot of reward. We can't transform that way. And we are placing so much emphasis on the economy, extremely important. But the base fundamental of this is healthcare. We're not having questions on that. Yes.
Thank you so much. So this person is asking, Kada Mbali, he's asking about what are short-term creative ways which are sustainable that you can propose as paths to funding healthcare post-COVID-19?
Let me start to say, in my own view, the first thing is that you need to work on a citizens database and embed a social contract into it. It means people participate within the environment. We know how to get ballot boxes everywhere. We know how to get voters card into everybody's hands. We need to have a national identification that goes across everybody. I mean, this is the reason why we are even lifting the lockdown, because we know that we'll continue. There's no comprehensive mechanism to distribute palliatives to people. The US government said we want to give $1,200 to everybody any less than $75,000. in terms of health taxes and income. Everybody got that money. I didn't hear anybody say, I filed for my taxes and I didn't get $1,200 check in my mailbox. So there has to be a structured way that we live as an organized society. And I think that's fundamental to wherever we are trying to change. The second thing is the health insurance system. There has to be a contributing health insurance system. That is an integral part of the tax payment that everyone pays. That's what you call a minimum tax, individual minimum tax. Even if you're a market seller or you're a road seller, there's some contribution you have to make into the society, because that is critical to how you're part of a state. And so I think that's second. And then the third thing is warehousing funds, warehousing percentage. So what we have as a National Health Act, we need to replicate that across the country. So we don't have state government having a pie and all the pie goes to, we pay salaries, we build bridges, and we build roads. There has to be, if it's a constitutional amendment, it has to be of a percentage of your health, of your budget, of your spending, that must be directly channeled to improving the welfare of health workers and also the infrastructure where they work and things like that. So there has to be some deliberate thinking to it. And that's the three-pronged way I would put this.
For me, I would say, in terms of releasing more funds for healthcare, I would say number one, taxation, just compulsory taxes, whatever you like to call it. If it's going to MTN and saying, okay, 5% of what everybody spends on the phone now comes into a healthcare fund, then, whatever way that you can get money from every single individual with a relatively good amount of information. People already have their mobile phone data captured. We have their fingerprints, we have their supposed addresses, we have some kind of biometric registration. That will do for starters, but we need to have some way that everybody pays into that healthcare fund. Number two, I think we need to sort out our relationships with our donors. So just because somebody is giving you money does not mean they can do anyhow. So we need to make sure that our donors, we have a way of dealing with the donors that is structured, that is long-term. Not that one disease is fashionable, they'll come in for 2 years and then they'll now cut the funding. We don't have any funding. We need that donation to be long-term, and it needs to be in areas that we deem important for our 10-year healthcare system growth plan. If they're coming with money and it's not relevant to what we're doing, either you channel it to what we're doing, to our plan, or you leave it alone. So we need to be a bit more structured with the donation. So the money that is coming in is structured. They're going through a ministry, or they're going through a structured process, and the money is going into the right places that conform with our areas of need, not the areas of need that were figured out in, in Venice or somewhere, and they're just estimating that we need this. So I think, first of all, some form of global taxation or deep taxation where everybody contributes into a healthcare scheme. Secondly, streamlining the donor funds to make it more useful. Thirdly, I think we need to sort out our budget. Like 66% of our current budget is being spent just paying back people that we owe. I think we need to, to any debt forgiveness that we can get right now and restructure the debt we do have, so that there's more fiscal space, so that we have more space to spend on anything. Because right now, our budget is almost a work of fiction. That 20 billion that, or 20 to 30 billion that we say we have, most of it is being spent either on salaries or on debt. It's not being spent on stuff. And that's why I say it's a work of fiction. So we need to really decide, restructure our fiscal situation to make sure that we have more money to actually spend on everything, including health.
There's a question that is directed at you, and it says, given your frontline experience, what is your sense of the magnitude of undetected COVID cases in Nigeria? If you can briefly just answer that if you want, and then share when there's a question that is coming to you. So Ola, quickly.
I think that we're gradually getting through the bottlenecks in the testing chain. I think that, there's problems with sampling, there's problems with labs, there's problems with reagents in the lab, there's problems with people trained to do the test, there's problems with accreditation of different labs. There's bottlenecks throughout the chain. But I think that we've been very, very good at ramping up the number of functional labs, for instance. We've been very, very good at opening up new testing centers and sampling centers and innovating. I mean, Lagos State, a few weeks ago, decentralized testing to make sure more cases are being picked up. So I still think there are people, obviously, that are undetected in their homes. We can't be as efficient as the UK or the US in terms of testing because of the cost constraints and because of the way that we've decided to do our testing. So we're not using the rapid test kits, we're using PCR, and PCR requires an expensive lab, no other way to look at it. But I think that we have done quite well. And I think the number of the undetected cases will continue to reduce as we continue to ramp up these testing facilities in terms of sampling facilities, in terms of getting reagents in terms of training staff to work in the labs, and in terms of activating the labs as we go.
Thank you so much. Seun, so someone is asking, I think you touched on this a little bit before, but how would you compare the responses of different state governments to COVID, Lagos versus Kano versus Rivers? And what would you define as key financing levers that states can pull to respond better? I know that Ola spoke about, how Flying Doctors is responding and is partnering with states. But if you just quickly touch, for you, what are the key financing levers that states can pull to respond better to the pandemic? And as we have spoken about earlier, epidemic preparedness is about getting ready before. And now we find ourselves in the middle of a pandemic, and states in different levels of preparedness. But if there's anything they can do, what can they do now?
Okay, I mean, I feel let's start with the states. I mean, this is where leadership is maybe much more evident. I mean, if, in terms of crisis, it can be maybe a distant measure to understand how capable a leader is. And I feel the governor of Lagos State has done well. I mean, as to be able to mobilize private sector support, even though Lagos State, like I said, I give you my experience with my gate man. Lagos State also has, over the years, underfunded the healthcare sector. I mean, they start using roundabouts and building, some overvalued bus stops. I mean, I feel this is the time they should rethink this. That you can't position yourself as a state that's largely run by tax and not have a robust healthcare system. So Lagos State needs to do more work. But in terms of the emergency situation and cobbling together response from everywhere, I think that's been great. Lagos is in community transmission stage already. I mean, that's just the reality. And I feel there was a lot of factors beyond the Lagos State government. I mean, for example, shutting down the airports, as soon as early as possible. That is not something within the capacity of Lagos. So I feel more of the chaotic decisions actually came from the federal government itself. I mean, in terms of not having the structure of a plan in terms of combating this disease. The second thing, the Kaduna State has done well. I mean, some states also, and I think doing well also, we have to situate that in the size of the cases that you have. I mean, would we say Cuomo has done well? Cuomo has over 20,000 deaths in New York. I mean, over hundreds of thousands of cases, and I mean, these things are relative. Also, you have to be grateful to the number of cases you have, because if these things escalate and overwhelm your capacity, it could actually show that you really don't have enough depth like that. So, I mean, also being able to manage at this scale for a country, I think that's still commendable. What we need to do more is to test and test and test and test more. In the relative size across even the continent, our testing size is relatively shameful, very, very shameful. I mean, South Africa has tested over 300,000 people. We are even yet to test 30,000 people. So somehow we need to think clearly about this. The final thing also is about financing for healthcare for states. I feel, I think I've alluded to that. Number one, this can't be something that states can do alone. So it has to be a comprehensive national strategy, because there's a contagion effect when it comes to healthcare. If it doesn't work here, people will migrate to new places, and it's going to bring out the cost crisis. So there has to be a national strategy. Like Dr. Ola said, there has to be a payment that the citizens are aware of and they are conscious of. So it could be them taking it from their recharge card, it could be a levy, individual levy of everybody. There has to be a way that citizens, and it has to be accountable, because trust is critical to all of these things. If I'm giving government money and it's not coming back to me, or I'm not seeing that it's effectively spent, then definitely I don't want to be part of this. So it has to be a national strategy, and also donor funding also has to come into play. And I'm happy with Dr. Ola said the donor funding also needs to be strategic and coordinated. Not every time we're jumping into tuberculosis and we're moving tuberculosis and with HIV today and next tomorrow. Somehow there has to be us fixing the backbone and fixing the infrastructure. Primary healthcare centers, what should be the standards like? The workforce, what should be their training like? The infrastructure or the equipment they use to work, what should that be like? The donor agency also, they need to help us in those regards. I mean, not just us trying to interject or trying to support, on a very, very chaotic basis. So, I mean, that's the way I see it at this point. I know we are running out of time, so I would like to stop at this mark here.
Thank you so much, Seun and Ola, for such an invigorating conversation. Thank you to everyone who is on this webinar with us. And if it's an epidemic anywhere, it's an epidemic everywhere. I think as we've all seen with COVID-19, you cannot say it's not in my backyard, it's not in my house, so therefore I don't worry about it. And this series basically today was to talk about how funding, is crucial, not only while an epidemic is happening, but to prepare for an epidemic. They always talk about, prepare for war during peacetime. And now that we're in the middle of it, we are beginning to figure out that we needed to be more prepared. Ola Onigbinde is the CEO of Budge IT, also known as Budget, and Dr. Ola Brown is the founder of Flying Doctors Nigeria. They have been incredible speakers in today's webinar. We thank all of them, and from us here at Nigeria Health Watch, do have a good day, stay safe, and continue to take responsibility. Thank you.